Yeah. How much stress levels?
Manageable. I've seen you having much higher stress level. The things for you take the moment, or are you taking it easy, or managing it better?
Probably managing it better.
Is your yoga routine new classes?
Not enough. But I'm not taking as much on board, you know.
Okay.
Just generally trying not to worry so much.
That's the rule. Okay, we'll have a little bit of demonstration. Mr. Keith at the moment is subjected to lumbar spondylosis. To be more precise, it is retro-lumbar spondylolisthesis, where the lumbar region, the vertebrae which confine to the lumbar region, shifts in the retro manner or in the opposite direction. Okay. Now there are, in total, how many vertebrae do we have? 33. Yeah? How many vertebrae? Total? 33 is ideal. Vertebrae 33. Remember, I told you it rhymes. Manner in which you could remember. And also Christ was crucified at the age of 33. So you could remember in what way you would opt to use. Now the 7 cervical regions support the neck area. 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 3 if not 4 is your coccyx. Okay. Now remember we spoke about the back shoe points. Back shoe points are points which run along the vertebra parallel to one another on the erector spinalis muscle. The muscle which erects erects the vertebral column, right? And the points communicate or coordinate with the internal organs, and they become tender, if not vulnerable, when there's a problem pertaining to the internal organ. We did this in the morning, just to refresh your memory. Okay, now what I'm doing basically is to palpate the regions which has the shift. And I go in between the vertebral columns, and eventually I will also support it by penetrating the points along the erector spinatus muscles as well. Okay. 1.5 chun, which is 2 finger breadth, lateral on each side, is where you find the points which conform to the urinary bladder channel, which also would, in the process of stimulating the internal organs as the back shoe points, will also strengthen the erector spinatus muscle. Now if I may ask you a question as to what an acupuncture point will do, the efficacy of an acupuncture point. Now the basic answer to that is an acupuncture point treats the local area, the adjacent area, very good, along the meridian, along the couple meridian. Okay, hypothetically, if you're looking at the urinary bladder channel, which is the couple meridian? That's the UB channel. Huh? No, the kidney. Urinary bladder is coupled with kidney. Yes. So once again, local area, adjacent area, along the meridian, coupled meridian, related organ, the coupled organ, excess of mother, and depletion or deficiency of son are the regions which an acupuncture point will treat and cure. So now you see a point has a wide spectrum or an array of area in which it derives the benefit for your patient. Yes? This explains as to why when you use a needle at one particular spot for a particular disease, the patient perhaps will come the following day and say, look, doctor, the problem which you addressed me is fine, but also in the process, I'm cured of another problem which I've been subjected to. Yes. Example, the patient has a problem with the lung. You start treating him with the lung point, right? But the following day the patient can come and tell you, doctor, yes, my lung is fine, I can comfortably breathe now. But also I forgot to tell you yesterday that I have a problem with my large intestine. I was having difficulties in moving my bowels. But this morning after your treatment I feel much comfortable. After passing my stool without any problem. Did you also treat for my constipation? With or without your concurrence, the acupuncture needle has addressed the other problems which are pertaining, because a needle will not confine to one particular therapeutic benefit for which it is used. It also will, in the process, treat the other areas with or without your concurrence or blessings in order to benefit the patient. This is why acupuncture is being reckoned with as a very important modality since the century before Christ, and even today it is gaining popularity and momentum in much greater speed and manner than any other modalities. Having taken the lung region, you now address the distal point. Yes, there are many distal points, of which 6 are frequently used. And the one which will address the lower back is the point which is on the crease, which is called the popliteal crease. You have the popliteal fossa, the popliteal crease, and right in the middle you have a point which is UB40, Weisdorf, excellent, Weisdorf UB40, which is the back, which is the distal point for the lower back region. Right? Okay, now Dr. Ibrahim, if I ask you, what does this point treat? The point UB40, which problems does it address? You immediately start thinking of the basic, the local areas, if there is any lesion in this region. Yes? If there is any pain in this region, this one needle will address the pain. It doesn't stop there. It goes beyond by addressing the problems in the adjacent area. If there is any problem in the adjacent region also, it will address. It goes even beyond. If there's any problems in the UB channel, will be addressed. The problem can be somewhere else. Further, one needle can address the entire pathway on which you have selected the needle. It goes even beyond. It also addresses any problems in the urinary bladder by itself. It addresses the problems of the urinary bladder by itself. Having done so, having accomplished the mission along the urinary bladder and also the channel, it goes beyond by addressing the couple meridian, which is the kidney. Somebody has non-retention of urine or retention of urine. If there's any problem pertaining to the kidney, one needle which is on the urinary bladder also will address it. Right. And then it goes beyond by addressing the excess of mother and deficiency of son. We will talk about this when we do the 5 elements theory. The excess of mother. Now, urinary bladder conforms to which element? Water. Yes, urinary bladder conforms to element water. Now, what is the mother of water? Mother of water is metal. Metal. Right. Urinary bladder conforms to yang polarity. Right. And what is the mother? Metal. What are the organs that conform to element metal? Lung and large intestine. Now, corresponding to the yang polarity of urinary bladder, the lung becomes large intestine. So if there is any problem,